This is Mark Evans with Texas Tech Psychiatry. In case y'all didn't know, October is actually ADHD month, ADHD Awareness Month. And with school back in the swing of things, many parents may be curious as to whether their children is actually having some ADHD symptoms. So that's what we're going to talk about today. So what is ADHD? ADHD is a neuropsychiatric condition that affects attention and impulsivity. Who does ADHD affect? So typically children will be affected with the disease. About 5 to 8% of children, of school-age children, are diagnosed with ADHD, and about 60% of children with ADHD will go on to be adults with ADHD. So it does affect children and can affect some adults. Now, children as young as 3 can start showing signs and symptoms of ADHD, but the majority of patients with ADHD or children with ADHD will be diagnosed in the school age years when they start preschool or kindergarten, which makes sense because typically that's when we ask children, or that's when a person is first required to engage in these tasks that require sustained attention. ADHD does affect boys more than girls. It's about a 2-to-1 ratio. So more boys will be diagnosed with ADHD than girls. And there is a genetic component to ADHD. So children who have parents or siblings diagnosed with ADHD are at an increased risk of developing ADHD. Now, how does ADHD present? So there's 2 general symptom clusters associated with ADHD. The first one is inattentive symptoms, and the second symptom cluster would be hyperactivity or impulsivity symptoms. So with inattention symptoms, these children oftentimes have trouble sustaining attention. In school, they might start an assignment with enthusiasm and vigor, and then give up really easily. At home, they may have trouble completing tasks, specifically tasks that require sustained attention, like washing dishes or folding laundry. They can oftentimes be described as clumsy or accident prone. They can also be described as forgetful. They'll frequently lose things like their toys or schoolwork, etc. And they may need to be asked several times to complete something, even something simple like picking up after themselves. Now, the hyperactivity symptoms present differently. So these symptoms oftentimes present as behavioral problems in school. They're oftentimes easier to spot because they do cause issues at school. And these symptoms are usually what lead teachers and other school officials to send home parent notes. But they can oftentimes, so patients with impulsivity issues can oftentimes present with an inability to wait their turn, blurting out answers. They can oftentimes be described as fidgety or high energy. Oftentimes they'll run the hallways, or they'll climb desks, tables, bookshelves. They usually have lots of energy. Impulsivity symptoms can also present like mood symptoms with tantrums, irritability, or these explosive episodes. Now, a diagnosis of ADHD is made when you see, is made based off of DSM criteria, and DSM stands for Diagnostic and Statistical Manual of Mental Health Disorders. And now there's a total of 18 symptoms. There's 9 inattentive symptoms and 9 hyperactivity symptoms. In order to meet the diagnosis, the child has to have 6 of each. And then the symptoms have to be present before the age of 12, and they have to be present in 2 different settings, so usually at home and school. Now, typically, they do send questionnaires, so parents will fill out a questionnaire, and teachers will also fill out a questionnaire just to make sure that there's issues going on at both at home and school. Now, as far as treatment goes, first line treatment for ADHD is stimulants. So psychostimulants like Adderall, Concerta, Ritalin, those are typically first line for ADHD. Stimulants are typically well tolerated and very effective for the treatment of ADHD. So if y'all have any questions, come see us.